Hi, I'm Dr. Prasanna Edirisingha, working as a family medicine specialist in NMC Medical Center, Shahba, Sharjah. I have experience of 15 years in family medicine. My area of expertise is acute and chronic disease management. Today I'm going to discuss about undiagnosed but very common disease called iron deficiency anemia. This condition is especially very common in reproductive age women, children, pregnant women, teenagers. It's often missed because of people think these symptoms are due to stress of my life or busy work. Is very important supplement for build up hemoglobin in your red blood cell. That will help to bring oxygen to your all body tissue. If the iron is low, you will not get enough oxygen to your brain and other organ in your body. It will affect your brain function, energy levels, mood, even immune response. Early symptoms of iron deficiency anemia included fatigue, low energy level, difficult to concentrate, brain foggy, hair loss, hair thinning, irritability and low mood, and restlessness in your leg in the night. Later symptoms included you feel your heart is fasting, even with small activities you feel shortness of breath, and you feel cold in your arm and feet, and sometimes dizziness and lightheadedness and pale skin. Yeah, it's very common in reproductive age women, pregnant and postpartum, and children with poor diet and pricky diet, and people, those who are using medication like antacid and proton pump inhibitor that we are giving for the gastritis for a long time, and people with inflammatory bowel disease like celiac disease and some bacterial infection like Helicobacter pylori infection, and some people is having hemorrhoid and some people with ulcer. Those are the people is high risk of getting iron deficiency anemia. If you are part of this group, if you feel mental foggy and weak, it's worth of screening with CBC and ferritin. Diagnosis, we will start with clinical picture. Then we will go for blood test CBC and ferritin. In CBC, we will check for your hemoglobin level and other red cell parameters. In ferritin, we will get about idea about your iron store in your body. That is very important test to diagnose iron deficiency anemia. In some complex cases, I will do serum iron and total iron binding capacity. Iron deficiency can exist with normal hemoglobin. If you feel that clinical picture is fit with iron deficiency, better go for serum ferritin. To overcome iron deficiency anemia, we have to include iron-rich food in our diet. It's included heme contain iron you will get from liver, fish, meat and poultry, and non-heme contain iron you will get from vegetable like spinach, lentils, cereal, dry fruit like dates and fortified cereal. And vitamin C is also very important for iron absorption from your gut, including vitamin C contained food like lemon, lime, tomato, citrus fruit. It will increase absorption of your iron. And other thing I want to especially and very important thing is tea, coffee and dairy products will interfere iron absorption. That you have to be very careful. Don't take this kind of food before 1 hour meal or after 1 hour. Treatment will depend on severity of the disease. Mild cases we will start with diet management with oral iron supplement alternate days. In moderate cases, we will go for oral iron supplement daily with IV iron injection for those who are not tolerate well and those who have malabsorption. And we have to avoid oversupplement. It will damage your liver and other organs. We will recheck your CBC and ferritin after 6 to 8 weeks to assess your iron level in the body. And very important to keep in your mind, before you start iron supplement or before you stop supplement, you have to consult your family medicine doctor. Many of the patients, they will stop iron supplement early due to side effect. So I recommend taking alternate day dosing to avoid side effect. Iron deficiency anemia is undiagnosed but very common problem in women and children. So if you have this symptom, better to meet your family medicine doctor. Iron deficiency anemia causes fatigue, low mood, poor immunity, and hair loss. Most of the people, they suffer years without knowing cause. Most of the people suffer years without knowing the cause. The good news is it's very simple to diagnose and easy to treat once it's identified. My take-home message is eat iron-rich food. Avoid coffee and tea during a meal. Ask your doctor for ferritin test if you have this kind of symptoms. Don't ignore constant tiredness and hair loss. These are the signs your body is asking for help. I believe I given brief idea about iron deficiency anemia. If you want to know more about iron deficiency and if you want to consult me, I'm Dr. Prasanna Sangeewa Edirisingha, family medicine specialist, work at NMC Medical Center, Shahba, Sharjah.